basically I decided to make a movie about essentially the insurance companies, and especially for people who have insurance, because that's the majority of Americans, who think that, well, we don't really need to change the system because everything, everybody assumes it'll be there for them when they face a time of crisis. And also thinking about what we can do to reach across the great divide that exists in this country, and not make this a partisan issue. That illness knows no political stripe. It doesn't care if you're Democrat or Republican, liberal or conservative, and that we need to find some common ground, all of us, no matter who we voted for or what we believe in, and say on this issue we've got to come together for the betterment of everyone, and not make it a partisan thing. At least that's my hope. Anyway, so I'd be happy to answer any questions or hear anything you'd like to say or whatever. Just feel free to raise your hand and I'll call on you. And yes, sir.
We do seem to have this great health care system almost on a national level in this country called Medicare. And the healthcare industry has been very successful in shifting those that are the eldest and sickest into that program for obvious reasons, to save money for the healthcare industry itself in terms of profits.
Yes.
The administration costs for Medicare are extremely low compared to the private sector.
That's correct.
The way healthcare is administered in this country.
Right.
And there were some general accounting office studies back in the early 90s that go to that issue, that we could actually insure a lot of
I
these.
wish the media would cover this issue more. He's talking about how we do have socialized medicine in this country. It's called Medicare and Medicaid. And while both of these are underfunded and need more support than they're given, generally, if you ask your parents or grandparents, they generally don't have many complaints about Medicare, nor do they have complaints about Social Security, which is a huge government program. And I know my dad says his check comes every month on the same exact day through the so-called dilapidated U.S. mail, and remarkably, it's for the same amount every month. How do they do that for tens of millions of seniors? And we've been fed this whole thing about the government is bad, the government can't run anything, the government... Well, first of all, we're supposed to be the government. That's the way it's set up. And secondly, the government used to do a lot of things right. I mean, the government defeated the Nazis in less time than it's taken us to secure the road from the airport to downtown Baghdad. I mean, but you can see why people are less and less inclined to trust the government anymore, because it doesn't seem to do anything right. But I don't think the concept isn't wrong. I heard Al Franken say on TV a few weeks ago, he said, certain people, certain politicians run against the federal government, saying, oh, big government's bad and evil and all that. And then they get elected and they spend the next 4 years proving themselves right. Anyways, the average health insurance company spends anywhere from 15 to 30% on bureaucracy, 15 to 30% on their administrative overhead costs. Medicare and Medicaid spend 3%. You'd think the government would be the opposite, right? It'd be more than the private, the way we've been told.